Vitamin D, often called the sunshine vitamin, is crucial in maintaining overall health and well-being. However, despite its importance, a significant portion of the global population suffers from vitamin D deficiency. According to recent statistics, approximately 1 billion people worldwide are deficient in vitamin D, making it a prevalent health concern. In the United States alone, studies estimate that around 42% of adults are deficient in vitamin D. In today's video, we'll delve into the 10 signs your body might exhibit when lacking adequate vitamin D levels, shedding light on the importance of addressing this deficiency for optimal health. Number 1. Fatigue and weakness. Studies have shown that vitamin D deficiency is strongly associated with feelings of fatigue and weakness. Research published in the Journal of Clinical Endocrinology and Metabolism found that individuals with low vitamin D levels experienced more significant fatigue and decreased muscle strength compared to those with sufficient levels. Furthermore, a study in the American Journal of Clinical Nutrition reported that correcting vitamin D deficiency improved fatigue and energy levels. According to the National Health and Nutrition Examination Survey, NHANES, conducted by the Centers for Disease Control and Prevention, CDC, fatigue is a common symptom reported by individuals with vitamin D deficiency. Data from NHANES revealed that individuals with low vitamin D levels were more likely to experience persistent fatigue compared to those with sufficient levels. Number 2. Bone and muscle pain. Vitamin D is crucial in maintaining bone health and muscle function. Therefore, a deficiency in this vitamin can manifest as bone and muscle pain. Research published in the Journal of Steroid Biochemistry and Molecular Biology indicates that low vitamin D levels are associated with an increased risk of musculoskeletal pain, including back pain, joint pain, and muscle aches. The National Institutes of Health, NIH, reports that individuals with vitamin D deficiency are more likely to experience bone and muscle pain. NIH studies show a significant correlation between low vitamin D levels and reports of chronic pain conditions related to bones and muscles. Number 3. Impaired immune function. Vitamin D supports the immune system and protects against infections. Therefore, deficiency in vitamin D can lead to impaired immune function and increased susceptibility to illnesses. A study published in the BMJ revealed that individuals with low vitamin D levels had a higher risk of developing respiratory infections, such as the common cold and flu. According to National Institutes of Health (NIH) data, vitamin D deficiency is associated with compromised immune function. Research conducted by NIH suggests that adequate vitamin D levels are essential for maintaining optimal immune response and reducing the risk of infectious diseases. Number 4. Mood swings and depression. Vitamin D deficiency has been linked to mood disorders, including depression and anxiety. Research published in the Journal of Affective Disorders indicates that low vitamin D levels are associated with an increased risk of depression and mood disturbances. Furthermore, a meta-analysis published in Psychosomatic Medicine found that supplementation with vitamin D significantly improved symptoms of depression. Data from population-based studies such as the Nurses' Health Study and the Health Professionals Follow-Up Study show that individuals with low vitamin D levels are more likely to experience mood swings and depressive symptoms. These studies, conducted by Harvard University, highlight the importance of adequate vitamin D levels in maintaining mental well-being. Number 5. Hair loss and thinning. Vitamin D deficiency has been implicated in hair loss and thinning. Research published in the Journal of Stem Cells Translational Medicine suggests that vitamin D plays a role in hair follicle cycling and regeneration. Low vitamin D levels may disrupt the hair growth cycle, leading to hair loss and thinning. Studies conducted by dermatologists at various medical centers have observed a correlation between vitamin D deficiency and hair loss patterns. Clinical data from these studies indicate that individuals with vitamin D deficiency are more likely to experience hair thinning and shedding than those with sufficient levels. Number 6. Impaired wound healing. Vitamin D is essential for proper wound healing, as it is crucial in immune function and tissue repair. Research published in the Journal of Investigative Dermatology suggests that vitamin D regulates inflammatory responses and promotes the formation of new blood vessels, critical for wound healing. Clinical studies conducted in hospital settings have found that patients with vitamin D deficiency experience delayed wound healing and increased complications following surgeries or injuries. Data from these studies underscore the importance of adequate vitamin D levels in promoting optimal wound healing outcomes. Number 7. Cognitive impairment and memory problems. Vitamin D deficiency has been associated with cognitive impairment and memory problems, particularly in older adults. Research published in the Journal of Alzheimer's Disease suggests that low vitamin D levels may contribute to the development and progression of cognitive decline and dementia. Furthermore, a study in neurology found that individuals with insufficient vitamin D levels had a higher risk of developing Alzheimer's disease. Population-based studies, such as the Rotterdam study and the Framingham Heart study, have provided evidence linking vitamin D deficiency to cognitive dysfunction and memory impairment. These longitudinal studies demonstrate a significant association between low vitamin D levels and decreased cognitive function over time. Number 8. Digestive issues and irritable bowel syndrome, IBS. Vitamin D deficiency has been implicated in various digestive disorders, including irritable bowel syndrome, IBS, and inflammatory bowel disease, IBD. Research published in the World Journal of Gastroenterology suggests that vitamin D plays a role in modulating immune responses and maintaining intestinal barrier function. Low vitamin D levels may contribute to intestinal inflammation and exacerbate symptoms of IBS and IBD. Clinical studies conducted at gastroenterology clinics have observed a higher prevalence of vitamin D deficiency among patients with digestive issues. Data from these studies indicate that individuals with low vitamin D levels are more likely to experience abdominal pain, bloating, and diarrhea associated with IBS. Number 9. Increased risk of cardiovascular disease. Vitamin D deficiency has been linked to an increased risk of cardiovascular disease, CVD, including heart attack, stroke, and hypertension. Research published in the American Journal of Cardiology suggests that low vitamin D levels may contribute to the development and progression of atherosclerosis, a condition characterized by plaque buildup in the arteries. Large-scale epidemiological studies, such as the National Health and Nutrition Examination Survey, NHANES, and the Women's Health Initiative, WHI, have found a significant association between vitamin D deficiency and cardiovascular risk factors, such as high blood pressure, elevated cholesterol levels, and arterial stiffness. These findings underscore the importance of maintaining adequate vitamin D levels for heart health. Number 10. Increased susceptibility to infections and immune dysfunction. Vitamin D is crucial in supporting immune function and defending the body against infections. Research published in the Lancet Infectious Diseases suggests vitamin D deficiency may increase susceptibility to respiratory diseases, including the common cold, flu, and pneumonia. Low vitamin D levels have been associated with impaired immune responses and decreased production of antimicrobial peptides that help fight off pathogens. Clinical trials conducted in various populations have demonstrated the protective effects of vitamin D supplementation against respiratory infections. A meta-analysis published in the British Medical Journal found that vitamin D supplementation reduced the risk of acute respiratory tract infections, particularly among individuals with low baseline vitamin D levels. In conclusion, it's essential to be aware of the widespread prevalence of vitamin D deficiency, especially in regions like the United States, where a significant percentage of the population is affected. Recognizing the signs of deficiency is crucial for early intervention and addressing potential health risks. Vitamin D plays a vital role in various aspects of health, including bone health and immunity. However, it's essential to ensure a balanced intake and avoid excessive consumption, which can lead to adverse effects. Always consult your healthcare provider to determine your specific needs and follow their recommendations. Remember, the information provided in this video is for educational purposes only and should not be construed as medical advice.